Again, we are going to get started in just 60 seconds. So we're going to get started. Good evening, everybody. Hope everyone is prepared for the little bit of inclement weather that we're going to get this evening. And as always, we'll be taking your questions, so get them in as quick as possible. We will get to them as soon as we get through our brief agenda here. All right. Good evening, Baltimore. You are tuned into the 410 Report with Mayor Scott. I'm excited to have you all join us this evening. I'm looking forward to hearing from you all again. As always, tonight again, I am joined by our Health Commissioner, Dr. Zaraza. We'll be reviewing the latest COVID statistics and new mandates, so we're going to jump right into it. As of today, January 25th, our city has had 37,020 cases of COVID-19 in Baltimore. 401 people are hospitalized with COVID-19, and our ICU utilization rate is at 87%, and our acute care utilization is 86%. We have lost 713 deaths. We have had 713 deaths due to COVID-19 in Baltimore City. We are seeing slight reductions in cases. New cases are decreasing, and we know hospitalization rates are down. And although this is good news, we are still counting and continuing to count on everyone to be responsible, to do their part, and keeping the downward trend going. We have the lowest positivity rate in the state, and we want to continue to have that and exercise caution as we keep moving forward. As you all know, with the cases leveling out a little bit, outdoor dining has been reopened at 50% capacity with a 1 hour time limit. Flaps of any tents must be open. Indoor dining is at 25% with the same limit, and restaurants also must keep a sign-in, sign-out sheet for patrons as they are seated for both indoor and outdoor dining. Bars without food licenses are allowed to reopen at 50% capacity, outdoor 25%, indoor with the same time and the same sign-in sheets and the same restrictions for them. That also includes breweries. Gym classes are permitted to resume, socially distanced with masks, of course, and are limited to 10 persons, and all indoor recreation, with the exception of adult entertainment and hookah and cigar lounges, are open at 25% capacity. Finally, I just also want to say that we are now allowing for streaming of live performances at our establishments that we know are hurting, but also we would love to see them be successful in this virtual age. We're very proud of the residents of Baltimore for the work that all of us have done to put in how we have been able to get our cases down to this point. But we know, as I said before, that it's not over, and we have to continue to wear our masks, practice social distancing, washing your hands, all of those things. And I also want to mention some updates regarding vaccines. While the state moved into phase 1C today, Baltimore is still on phase 1A and 1B. We have a high concentration of healthcare workers in the city, but we have established a way for older residents to get in line to be contacted when appointments become available. I want to make sure that we lift that up now. Older adults in Baltimore City who are in priority groups 1A, 1B, without access to the internet can call 410-396-2273, 410-396-2273 for assistance in registering for the vaccine, and as the cases and the opportunity to get vaccinated becomes available. Older adults with access to the internet should go to coronavirus.baltimorecity.gov/COVIX, coronavirus.baltimorecity.gov/COVAX to sign up for a call when more vaccine slots become available. And today, the new vaccine site at BCC opened up, and we know that it's centrally located next to the big transit hub in Mont Auburn, so we're really going to be pushing folks there And now I'm going to turn it over to our Health Commissioner, Dr. Raza, for more information about where we stand, but also to talk more about vaccines in Baltimore. Dr. Raza?
Sure. Thank you, Mayor Scott, and thank you again for having me. As you mentioned, as far as where we stand, we are seeing a slight decrease in the number of new cases noted. So again, we are very cautiously optimistic that this number will continue to go down. We did want to monitor very closely, especially following the holidays, recognizing that people would spend time with families. We're also seeing that positivity come down. So our positivity today is 5.5%. And this is down about 6% from where it was a month ago. We continue to watch hospital utilization very closely. We've seen a slight decline in the number of acute care beds being utilized, as well as a slight decline in ICU utilization, but it still remains high. So we're still very cognizant of that. And as Mayor Scott has already mentioned, we still have to continue to do all of the things that have kept us safe so far. That's wearing our face masks when we're out in public, washing our hands, maintaining that 6 feet of distance, avoiding large crowds or gatherings, and really, if you're not feeling well, continuing to stay home. So not going to work, and not going out into public spaces if you're not feeling well. As Mayor Scott mentioned, this week we're excited. We expanded our COVID mass vaccination site. We transitioned from Port Covington to BCCC and are very excited about our partnership there. Also, as Mayor Scott mentioned, we're in phases 1A and 1B, and we've been directed by the Maryland Department of Health to really give prioritization to our older adults. So recognizing that 1B captured adults that are over the age of 75. So we're very cognizant of that. We recognize that this is still a very high-risk group. So certainly our healthcare workers and those on the front lines are at risk, but as are our older adults who are at higher risk for complications from COVID-19. So continue expansion of access to vaccine across the city, and appreciate the support of many of our partners who are doing the same thing, our healthcare partners at hospitals, as well as our federally qualified health centers. And with that, I'll turn it back to Mayor Scott.
Thank you. Thank you, Dr. D, and thank you for all the work that you and the health department has been doing to keep people educated and safe throughout COVID-19. We have a few questions in, and folks who have your questions, please get them in. And we have one, Dr. D, that I think you and I should tag team. Someone asked a question about why can't adult entertainment resume? What's the difference between an adult entertainment facility and a Walmart? And why aren't they on the same page? I will first say, before I turn it over to Dr. D, is to remind everyone that we don't have any Walmarts in Baltimore City. The largest kind of establishment that they have is Target, but we have to also remember that they have duties around wearing masks and making sure that our businesses are following social distance guidelines. And I'll let Dr. DeRosa talk about the health portion of it.
Sure. And I echoing again what Mayor Scott has said, Target and those types of places are considered essential because they do provide groceries. We have concerns about adult entertainment venues, about people, again, utilizing masks, as well as about the close contact that occurs in adult entertainment venues. So again, out of an abundance of caution, we are not out of the woods by any means. We've seen some improvement, but we continue to be very cautious about what activities that we're engaging in, right? Again, we still want to maintain that 6 feet of distance. We still want to have our mask on at all times when we're out in public.
Thank you. And Dr. D, the next question we have is, when will CVS begin to administer the vaccine? And I want to just expand upon that too, and just allow you to try to dig a little deeper and explain to folks how the partnerships with the pharmacies and hospitals and other folks will be working for us as we ramp up.
Sure. So the way that the partnerships with pharmacies have worked is largely the State Department of Health has been working with pharmacies through what's called a federal pharmacy partnership to ensure that our local pharmacies get vaccine. So in phase 1A, pharmacies were actually responsible for vaccinating long-term care facility residents and staff. So their vaccine allocation actually doesn't come through the local health department. They either get it directly from the federal government or from the state government. And we know that the state government has made the decision this week to allocate additional vaccine to pharmacies. So again, we see expansion in those sites, but we don't necessarily have control over which pharmacies get it and when. We make recommendations and have discussions with the state around where we think the greatest need is, but ultimately the state will make the decision around pharmacies. In terms of our hospital partners, again, in the beginning, they largely receive allocations to support healthcare workers. So they're hospital-based and non-hospital-based healthcare staff that either lived or worked in Baltimore City. So they began vaccinating their own. With additional doses, they have offered additional support for others in the priority group. So for instance, last week, Baltimore City Public School System announced a partnership with Hopkins. So Hopkins will be supporting, vaccination of public school staff. Additionally, we have other hospital partners who will help support vaccination of non-public school staff. So again, a lot of our role is working with our local healthcare entities, our hospitals, and our federally qualified health centers to identify the areas of greatest need. Again, while our allocation at the health department, we've been told to really focus on our older adults.
Thank you. And Dr. D, just as a follow-up there too, someone asked, are we going to be using nursing agencies to help with the vaccination, or are we going to go to some of the senior buildings, assisted living, and nursing facilities in a mobile way, because we know they might have problems getting around? Can you talk about how that kind of work will happen?
Sure. So we have used nursing agencies in the past actually to help with testing. We use a lot of temporary clinical staffing agencies to help with our testing operations. Likewise, with our vaccination operations, we're actually able to work with some volunteers. So we have students from Coppin State. We also have students from Notre Dame School of Pharmacy. And we have volunteers from Maryland Responds, which is a statewide clinical database where we can obtain volunteers to support vaccination efforts at our mass vaccination sites. To the question about mobility and going into senior housing sites, this is something that we're again working with partners to develop a plan that we would implement, and it will largely be modeled over some things we did in the summer and fall of 2020 around the flu vaccine. So in fall of 2020, we actually had vaccine campaign where we work with senior housing site coordinators to provide mobile teams that were disseminating the flu vaccine. So have taken lessons learned from that with plans to implement that at our local senior housing sites.
Thank you, Dr. D. And then there's a question about where you should get the vaccine. Should you get the vaccine in the county or the city, in our case, that you live in? The answer to that is yes. If you live in Baltimore City, you should be working through our local health department. We do know that if you work for another county government and you fall in the essential category, they may vaccinate you. But if not, you should be following the guidance of your local health department. And then, Dr. D, I guess this is one that I should take, and just will come to you a little bit around the purpose of the 1 hour limit for restaurants and bars. Again, we're talking about a public health pandemic. We want to make sure that we're allowing folks to, in a safe way, to visit our bars and restaurants. But remember, these are activities that you cannot do without taking off your mask. And we know the longer you're there, the more at risk. And we also want to make sure that people, especially when you're talking about bars, aren't getting to a position where they are losing the sense of the emergency because of the time that they've been there and being able to partake in some of the things. So we're going to be looking at our mandates as we do every week, like we have done before, and making adjustments as necessary based off where we are with the numbers. Dr. D?
Yeah, I mean, I think, the idea behind it for Mayor Scott was to limit that amount of time that people are in contact. So again, we know, COVID really is spread more easily in groups and crowds. And we also know that it's spread more easily the longer you have contact with someone outside of your household. So we are still aiming to limit that as much as possible, when we think about our precautions that we're putting in place.
Thank you. Dr. D, someone asked a question about where in the pyramid folks who are homeless will fall in line for vaccination. Can you want to talk about that?
Yeah, so our homeless are actually in 1B. So right after 1A, right after healthcare workers. So similar to what I mentioned around the senior housing sites, we recognize the need to go directly to these groups. So we have been working with these groups, working with the Mayor's Office of Homeless Services to prioritize and identify how to best ensure that this group gets vaccinated as well.
Thank you. Dr. D, Someone asked a question about when the registration will be back up on the website, and is there a timeline for us opening up phase 2A? And then there's also a question about how we're going to work to communicate and educate Black and Brown communities around the vaccine.
Okay, all really good questions. I'll try to take them one at a time. So I would keep checking back on our website. Some of the appointment slots are dictated by the amount of vaccine available. I would also check back for additional access points. Right now, you can actually go to the state's website to look for access points across the city. So obviously the health department provides vaccinations, but again, many of our hospital partners are doing it as well as our federally qualified health centers and some pharmacies. And so certainly I would look at some of those locations too to see if they're offering something. And then I think the next question was around, let's see if I can see.
It's around education for Black and Brown communities around the vaccine. We know about the hesitance for some folks in our communities.
Yeah, absolutely. So our communications group has already started meeting with community leaders as well as community members to gauge exactly how our message should be focused. We recognize that there's vaccine hesitancy, and much of it is grounded in historical truths. So I think we first want to acknowledge that this exists, that there is a reason for medical mistrust. We want to make sure that we're addressing it. We're also working to always be transparent and share what we know. We've done that from the beginning of the pandemic. This is still a new virus. This is still a new vaccine. So there will be things we don't know, but we know that we have to be transparent in order to gain trust, right? We also recognize that sometimes the government isn't the person you go to for that trusted message. And so we're going to be working and have already been working with local leaders and local trusted members of the community to spread that message. Sometimes it's your faith leader or it's, a community leader. So we're working very closely with all of those groups again, so that they can kind of be that messenger that shares, what we know to be true, but again, recognizing that, it's not always easy to trust the government.
Dr. D, just something I think we should point out for folks about how it works as far as how many vaccines come to you from the state and how that impacts the ability for us to get them out.
Yeah, so the state really makes the decision around allocations, and we often don't know until a couple days before it's actually distributed to us as the local health department. Again, recently the state has shifted some of that allocation to pharmacies, and so their supply hasn't increased. Therefore, our supply goes down when they shift it to other entities. Again, we've been advocating with the state for it to be given to our federally qualified health centers. We know that these are extremely important healthcare access points for many of our older adults. Many of our older adults have a primary care provider, right? And ideally, if their primary care provider can vaccinate them, they can also do the preventative care that many of our older adults need as well. So really advocating for our federally qualified health centers and hospitals to get those doses too, so that they can begin vaccinating our older adults.
Thank you. And these are a couple questions for me. We'll be doing the 410 report quite frequently, at least once a month, but probably more than that. And it's just a way for me to connect directly with the citizens, myself, agency heads, other folks who will have on other guests, to keep people informed about things that are going on in the city, and most importantly, to answer your questions. And then there's one question, Dr. D, remaining before we let you go, around, or two of them. Thoughts around recommendations for now wearing double masks, and then one around should city employees who live outside the city seek vaccination from the city or in the areas where they live.
Yeah, so as far as double masking, I mean, certainly currently right now, we're recommending, obviously, if you're at risk for exposure, we actually are recommending surgical masks. So for instance, this is what we have individuals wearing at our vaccination sites and at our testing sites. They wear the surgical mask plus the eye shield. Still, and this may be shifting, we'll also see what some of the messaging that comes out of the federal government. Still, surgical masks are recommended for healthcare workers, obviously, that are in contact with COVID-19 patients, but certainly there's a growing trend, across the world about people starting to consider, should we be looking at N95s more broadly. Again, I think supply early in the pandemic was an issue, and still continues to be a little bit of an issue. So it's something that that could change. So I say that to say that recommendation certainly might change.
Thank you. And the second question, Dr. Day, around employees, whether they should work through us or work through the county and where they live.
That's a great question. So one of the things we know is that the state has included continuity of government within their recommendations for phase 1B. As I mentioned, vaccine supply still remains limited. So the health department is actually going to work with the Office of Emergency Management to help agencies begin prioritizing and coordinating how agencies, especially those on the front line that are in the phases 1B and 1A and 1B, can begin to get vaccinated. So certainly the city is looking to support these initiatives and these efforts, and we'll be in contact with agencies soon. I've already met with a few agency heads around implementation and how we're looking to provide vaccinations to city employees.
Thank you. Thank you so much. And thank you, Dr. D. Thank you, everyone, for joining us tonight. We'll be back with more information on the next 410 report. I think we have a very special guest for our next 410 report. So make sure we'll be putting it out on social media over the next few days. So we'll see you next time. Continue. Remember, you can always get the latest updates on the COVID for Baltimore City at coronavirus.baltimorecity.gov. And make sure that you are monitoring the situation with the weather that we're having. When you see a snowy or icy street in your area, please make sure to call 311. You can see on social media how streets will be responded to and what priority. But if you put that request in at 311, they will make it to you. We just have to be patient. Thank you, everyone. Be safe and be healthy.